Alright, so this is going to be my scapula, and I'm going to label some of the points and stuff on it. Okay, so to start off with, going to start with the inferior angle, which is just the bottom part here. And it's kind of easy to remember because it looks like a triangle or an arrow pointing down. An arrow down like inferior, and the triangle could be like an angle. I don't know, whatever works for you, I guess. Alright, so the next one is the infraglenoid tubercle, which is a little crevice just in the lateral side of the scapula here, and attaches some of the bigger muscles from the back. So like I said, this is the lateral side, so all the way from the top of the infraglenoid tubercle down to the inferior angle is the lateral border. Cool, so this big area here is basically the shell, the whole makeup of the scapula really. It's where heaps of the back muscles attach and pass through, and it's what they call the subscapular fossa. And just remember that this is the anterior angle of that we're looking at it. Cool, so talking about angles, we have the superior angle, which is the opposite to the inferior angle. It's got the little triangle thing that I just drawn there, like an arrow pointing up for superior, or the triangle for the angle to help you remember. Cool, so this kind of little bridge thingy up here is what they call the superior border. It's superior because it's at the top and it borders the scapula. That works. Cool, so there's kind of a little dip thingy in here. It's what they call the suprascapular notch. I think I wrote it wrong when I was drawing it, but suprascapular notch. There's this little kind of jutted thing out here. It's called the coracoid process, and it kind of helps hold on to like the bicep brachii and those kind of muscles that come down into your arm. There's this other kind of sticky out jutted bit that comes from the back of the scapula onto the front called the acromion, and it articulates with the clavicle and kind of joins the clavicle to the scapula. There's kind of a hole in this bit here. I'm just trying to highlight it so that I can see it. It's called the glenoid cavity, and it's the socket for the ball and socket joint when the humerus joins into the scapula, so you can move your arms. Cool. So on the posterior side, instead of having a subscapular fossa, it's called the infraspinalis fossa. So I just draw a kind of little squiggly arrow so I know that it's on the other side. Cool, so now I'm going to go through some of the movements of the scapula, starting from the anatomical position. This one is protraction, so the scapulas move forward as your arms come forward, like you're protecting. It's protracting. So this one's retracting, so the shoulder blades come together at the back, like something's kind of gross or scary, you retreat, so the shoulder blades retract. This one's called elevation, so like if you were to elevate, you would go up, so this is what the scapula is doing, it's going up as it's elevating. This one's depression, so if you're depressed, you're kind of in a low mood, but down. That's exactly what's happening. The scapula depresses, it goes down. Right, now I'm going to go through the muscles that make these movements. So starting with protraction, to protract the scapula, the muscles are on the anterior side, so at the front of your body. And the two main muscles that protract, the first one attaches to the ribs like so, and it's called the serratus anterior. The second one attaches to the coracoid process, and it comes all the way down on top of the serratus anterior. It has three heads, so I'm trying to kind of emphasize that there, and it's called the pectoralis minor. Now we're going to flip to the posterior angle, so looking from the back, drawing a clavicle, the humerus, the spine, and some of the ribs, just so that you kind of see where everything else is on the body as well. Right, the next movement is retraction. So on the back side, remember, we have two main muscles that retract the scapula. This first one here attaches to that little notch down the side and to the spine. It's quite a big one, and it's called the rhomboid major. And the other one is a bit smaller, still attaches to the same notch into the spine. And funny enough, it has the same name. It's a rhomboid minor. So the major is the big muscle and the minor is the little one. Oh, this is on a bit of a funny angle. Oh, the next muscle that helps retraction actually helps with the next three movements. It's the trapezius. It's a really, really big muscle. I'm just going to draw the outline of it so that you can kind of see where it goes, and I can draw the other ones underneath. But the trapezius has three different levels of fibers. So the middle fiber here, that I'm just going to try and make a little bit darker than the rest, is the fiber that helps retract the shoulder blades. The lower fibers that start just under here, all of this bit underneath the middle fiber, is one of the main movers for depression, so dropping your shoulder down. The lower muscle, with fibers of the muscle, drop it down. It's all one muscle, remember. The other muscle that helps is the latissimus dorsi, which starts at the humerus and goes all the way down your back, down the side, but underneath the trapezius. Alright, so now the last movement is elevation. So there's two muscles that do this. The first little one here attaches to the little crevice in the scapula and goes right up the spine near your head. It's called the levator scapulae. And the other one is the last layer of fibers of the trapezius. So the upper fibers of the trapezius are what lifts your arms and your shoulders really up. Now I'm going to do kind of recap and just kind of make the muscles a little bit clearer because it's a bit messy. So for protraction, the three muscles, rhomboid major, rhomboid minor, and the middle fibers of the trapezius. For depression, the two muscles, the lower fibers of the trapezius, and the latissimus dorsi. Elevation, we have the levator scapulae, which is underneath the upper fibers of the trapezius. And back to the posterior side, the two muscles that help with protracting are the serratus anterior and the pectoralis minor.